first started coming to Bread for the City, I was doing a fellowship at GW and just fell in love with this little clinic.
I first came to Bread for the City when a friend of mine suggested that I come get a Thanksgiving turkey.
I knew that they had a clinic and legal staff and things like that. So when I got sick, I was told, go see Dr. Randy. And I've been a patient ever since.
I think what really attracted me was a real focus on relationships and sitting down with the patient and spending time with people and being able to work through problems together.
I was referred here by a friend, and it was the best thing that ever happened to me. Dr. Randy pretty much saved my life. I was anemic, critically anemic, and didn't realize it. It's just been uphill ever since.
2 years ago, I was sat in and I was doing something. And I did like this, and I couldn't move. Couldn't move. The circulation in my leg had stopped. And the only thing I could think about was Bread for the City. I almost crawled over to the Bread for the City from here, okay, and fell in the door. When I got to the emergency room at Georgetown University Hospital, they said, Mr. Valentine, you had 1 hour and 45 minutes to live. If I hadn't gotten to Bread for the City, I would have died in this apartment building.
The caring is real. It's not fake. You can look in the eyes and tell, they really care. And it's not just the doctors, it's the front desk. Who gets the phone? Downstairs, upstairs, everybody cares. And it's real, it's genuine.
It's kind of emotional to talk about, but I guess with Bread for the City, I feel like people understand what it's like. You can feel judgment. It's a real thing. And so I had actually experienced that in the past with a dentist, and I only went one time and I never went back because I just felt like he really couldn't understand why I hadn't taken better care of myself. And that's a very deep question. And so it's just nice to be somewhere and coming somewhere for services where I don't have to explain that. And people aren't asking me that. They're just interested in meeting me where I am and moving forward.
We really value the interaction that we have with our clients. We want to treat it like this is a lifelong partnership. Oftentimes I go to lectures or discussions, panels about how we should, as dental providers, work more along with our medical providers. And therefore, maybe behavioral health as well if we're lucky. Maybe work with some other social service agency. That's not a maybe here. When Dr. Randy says we establish a medical home, that's really what we do.
I think it's really a different model of care, and I think that's really something that we think about a lot. It's intentional. It's not that it just kind of happened this way. But it comes from this core value of dignity and respect and treating people as you would want to be treated. And how do we find equity in this kind of relationship?
It's shocking to go from coming into the organization as a client and end up being a board member. I think it not only changes, the way that I'm able to impact the organization, but it also changes how I see myself and the way that I show up in a lot of different parts of my life. There's no way to put a price on how valuable it is for someone to believe in themselves.
When somebody that you don't even know give you a helping hand, okay, you got to give back. You have to give back. Bread for the City was there, so I don't have any choice except to say, thank God for Bread for the City. Thank God for that medical center.